performing today is neonatal resuscitation. So at the very beginning, there's 3 questions that will dictate whether or not you keep the baby with the mother or you bring the baby under a warm radiator. So, is the baby term gestation?
Yes, the baby's a term baby, 40 weeks gestation.
Is the baby breathing or crying?
The baby is not breathing or crying.
Does the baby have good tone?
No, the baby is limp.
So the next thing we're going to want to do is dry off the baby, and this acts as a stimulant for them. So you want to vigorously dry them off. This is sometimes a 2-person job. You can also tap on the feet as well to stimulate them. And then after you're done, lift up the baby and remove the towel as it gets wet and cold. Okay, so by 30 seconds of age, the next assessment we want to do is whether or not the heart rate is above or below 100 beats per minute and whether they're breathing or not. So we can check the heart rate by using either a stethoscope, or you can use 2 fingers at the base of the umbilical cord, where there's usually a strong pulse. After doing a quick check at the umbilical cord, we've confirmed that the heart rate is below 100 beats per minute and the baby is not breathing. So this means that we need to proceed with positive pressure ventilation. So what you do is take the mask and you're going to put it over top of the mouth and the nose of the baby, making a C with your fingers and placing it over top. Okay, so once the mask is adjusted, you will want to apply breaths at 40 to 60 breaths per minute. So this translates to about 1 breath every 3 seconds. You can think of it like the speed of a waltz. So 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. Now, if you can feel that the breaths are not going in, there's an acronym called Mr. SOPA that's corrective steps to fix the ventilation. So there's mask readjustment to create a tight seal. You can reposition the airway by tilting the neck. Make sure that the suction is over top of the mouth and the nose. You can also open the mouth, increase the pressure, or use an alternate airway. So this all ensures that you are getting enough oxygen into the baby. So after around 30 seconds of doing positive pressure ventilation, we are going to need to check the heart rate again. So if the heart rate is below 60 beats per minute, then we are going to need another nurse to help in so that we can begin chest compressions. So chest compressions, you're going to use the thumb encircling method. So you're going to wrap your hands around the baby, having your thumbs below the nipples but above the xiphoid process. So this goes in a 3-to-1 ratio, about 90 compressions and 30 breaths per minute. So this translates into 1 and 2 and 3 and breathe in. 1 and 2 and 3 and breathe in. The person doing the chest compressions has to ensure that each compression goes to about 1/3 of the baby. And they are also the person that will be leading, calling out the timings. So 1 and 2 and 3 and breathe in. 1 and 2. After about a minute of coordinated chest compressions and providing oxygen, we're going to want to do another heart rate check. So after this heart rate check, we've determined that the baby's pulse is at 80 beats per minute, meaning we can stop with the compressions, but we still want to continue positive pressure ventilation until the heart rate is above 100. As we continue to apply the positive pressure ventilation, we notice that the baby is beginning to move, which is a good sign that the oxygen is working. And now the baby is starting to cry, which means that we can conclude positive pressure ventilation and bring the baby to the NICU for further observation.